Good morning to everybody in the room and to everybody playing at home. I'm Mel Keep. I'm from the Faculty of Health Sciences at the University of Sydney, and I suspect I win the prize for furthest travelled here today. So I'm going to shift gears a little bit this morning. Working in health, often our conversations around technology is about how we can use technology to make things better. So the hacker in the hood discussions yesterday was really interesting for me. Like, oh yes, there are bad people on the internet. When really a lot of our focus is on how do we harness the tools that we've got in order to do what we do better and to reach more people and to improve well-being. So what are we going to talk about today? So today I've got sort of two broad sections. The first one is about the impact of technology on our well-being and using social networking sites in particular as an example. So we'll go through some of the commonly used social networking sites such as Facebook and Instagram, and we'll also look specifically at online health communities and online support groups. And then I'm going to move into looking at how we can use technology to improve what we're currently doing in health and in delivering health care, and focusing in particular on online therapies and using patient portals. So I'm sorry, I'm making the cameraman work because I like to move. So what is the evidence around the relationship between social networking site use and well-being? Quinn and Old Meadow surveyed about 400, just over 400 9 to 13-year-olds, and they found that particularly in the older age group and in the boys, that well-being and a sense of belonging to their peer groups was linked with greater Facebook use. Social capital and social self-esteem was also linked with increased use of social media. And these two studies are survey studies, so it was really interesting when some of the other research came out and they were they were more experimental and contrasting those findings. So again, we find that self-esteem, social self-esteem and well-being improved in adolescents that used social networking sites more. So the picture seems, so far so good. More recently though, Lupp et al. Found that for people who used Instagram and followed strangers on Instagram and had a tendency to compare themselves with others, showed more depressive symptoms. And so we've gone, okay, not so good. So we got Cross et al. Did a really interesting study. So they had several hundred people, and what they did was they sent an SMS to them 5 times a day over a series of 2 weeks. And in those SMSs, asked people to respond immediately with how satisfied were they with their life and how were they feeling in that moment. And what they found was that people who were more heavy users of social media, and in particular Facebook, reported lower life satisfaction and less positive affect. And there was another study published just recently called the Facebook experiment. So what they did was they had over 1,000 people, randomly allocated them to the quit Facebook for a week group or the continue using Facebook as normal group. And what they found was that the people who quit Facebook for a week showed improvements in self-ratings of life satisfaction and positive mood. And so we've got sort of on the one hand people feeling like they've got a better sense of self-esteem, they're belonging, they're feeling supported socially, and on the other hand reporting depressive symptoms, loneliness and negative affect. So what's happening and why do we have these discrepant findings? So there are several explanations. The first one is the emotional contagion explanation. So a few years ago, 2014, there was a huge controversy about a study that Facebook conducted, and controversial because they didn't really have ethical approval to do it. So what they did was they manipulated the newsfeed of their users. And so for one group of people, they would just not show positive items on their newsfeed, and for another group they wouldn't show negative items on their newsfeed. And what they found was that people who saw only positive things in their newsfeed would use more positive words in their own posts, and people who only saw negative things tended to post more negative things. And so they believe that there's something in what you see on Facebook and what your interactions are that lead to these sorts of outcomes that you might have. The next explanation is around feedback type. So the proposal is that what you get out of Facebook depends on what you get on Facebook. So if you're getting a lot of support, if you're getting likes, comments, a reinforcement of your worldview, then you're more likely to get positive outcomes. In contrast, if you get trolls, then that's going to lead to negative outcomes. And Facebook had this huge media thing around the release of these reactions. So in addition to likes, people were saying, oh no, there are some things I want to dislike, because people post things that are inappropriate or are sad or that make them angry. And Facebook made a conscious decision not to put a dislike button on there because they were wary of the role of feedback in people's sense of well-being. So the third explanation is social comparison theory, and in contrast, this is something that sort of stems from offline research. So social comparison theory says that we, as humans, naturally have a tendency to compare ourselves with others just to get a feel for how we're going. And what happens though is that when you're on Facebook and everybody's only posting about the holidays they go to, the great conferences that they're at, the really nice restaurants that they're eating at, what you're getting is a snippet of the positive aspects of someone's life without the moderators of understanding some of the negatives, some of the downs in the roller coasters that they experience. So you're seeing all these great things about other people's lives and you're experiencing ups and downs. And because of that, you've got this distorted view of how positive other people's lives are, and when you do that comparison, your life feels like rubbish in comparison. And so that's, again, another explanation that people who tend to compare will perceive that their life is less favourable and lead to negative outcomes when they start interacting more online. So the fourth explanation is around active and passive use. And this, I think, sort of feeds into some of the previous explanations, but it's been proposed separately, so I'm sort of presenting it to you separately as well. So this theory says, or this explanation, says that you get out of social media what you put into it. So the more active you are, the more likely you are to get positive reinforcement. So, you know, if you've ever removed somebody from your Facebook friend list or following because they've presented a worldview that's different to yours, you'll understand that what we try and do is we trim the branches of the people who don't share similar worldviews to us on social media. And because of that, if you're active, you're getting people who are supporting you and reinforcing that worldview. In contrast, if you're passive, then if you're passive, then you don't get that same kind of feedback, and then it might lead to more negative outcomes. And so all of these explanations have evidence supporting them, and they seem to make sense. But they all seem to focus on the interactions with somebody else. And so it's like how you feel and what you get out of it in terms of your mental well-being depends on what other people do. And I think that's partly accurate, but I think it's also fairly limited. And what we propose is that in addition to peer interactions, that people's motivations for going online also affect what they get out of it. So if you're not online to compare, if you're not online because you want a large following, are you affected in the same way? And to what extent do motivations matter? So we looked at this idea of motivation in the context of Instagram use. And so this is these findings are part of a larger study on overall Instagram use. So as part of that larger study, we asked participants, do they use hashtags? And if they do, how many? And why do they use hashtags, or why don't they use hashtags? And what we found was about a quarter of participants didn't use hashtags, and they said that they didn't because they didn't know how to, because there were privacy reasons. Hello, people hearing at home, could you mute yourselves? So They weren't using hashtags because they didn't know how, because they were concerned for privacy reasons, because they didn't see a purpose to it, and because there are negative connotations with using hashtags. Of the people who did, though, what you can see, even if you don't look at what the colours mean for the moment, that people who use more hashtags per post tend to do so for different reasons than people who use fewer hashtags. And so it seems that there's something around motivation that affects how we use particular tools in social media. So if we go through the reasons, the blue is organisation. So these people said in open response text that they used hashtags because they wanted a way of filing all of their images into one place, or to easily recall or retrieve their images, or to provide a caption for their images. The people who in red use hashtags for self-expression think that it's cool, it's a way to be funny, it's a form of wordplay. People who use in the green hashtags for building connections want to use their hashtags to enable other people to find them and to find other people who share similar interests, to join a wider community that share these interests. Interesting, in purple are the promotion people, and so these people use hashtags because they want to get their images out there, and they specifically want to get their images out there because they want more followers, more likes, more views. Then we have people who, a very small group of people who use hashtags to find information, or because they find it interesting and entertaining. So an example might be that somebody, or one of the examples provided by the participants, is that before they're about to go to a restaurant, they'll look up the Instagram feed of that restaurant or of that venue just to see what's on the menu and whether they like it. And lastly, the miscellaneous category was around people who said that they liked the hash symbol, which is a bit odd, but they did, and they said it, so we reported it. A few people said they didn't know why they used it, but they just did because other people were using it. So they were part of our miscellaneous group. So it seems then that motivations matter, and motivations affect what tools we use on our social media. So what we think is happening, and this is the start of a conversation, so I'm not really here to defend this. I think one of the best things about being at a workshop like this is that you have lots of people in the room who are really good thinkers and who think differently to you. And so this, like I said, conversation starter. So I suppose what we think is happening is that there's something around people's motivations and their personality that feeds into the blue box, which is what they do online. And online you've got the things that you do, the things that you think, and the feedback that you get from other people. And then that all then feeds into the outcomes. And for us, the outcomes are well-being outcomes. Happens to no other speaker, just the one from Australia. You don't have to like my accent. So what we're interested in, and shameless plug for our study that we are currently still recruiting for, is we're interested in this particular study. So it's a project from my honours student in the, I'm too short to point, in the relationship between the motivations for why people go on Instagram, what they do on Instagram, and then what their outcomes are. And the outcomes that she's looking at is perceived social support and life satisfaction. Slides will be available online as well in case you missed the URL. Okay, so we've spoken about social networking sites that we all tend to use and have access to. What about specific communities that are designed for people with a health problem or a health condition, or are caring for somebody with a health problem? So these online communities can be groups within Facebook, for instance, breast cancer groups on Facebook. They could be more specific groups, such as the ones found on sites like Patients Like Me. And what the research has shown is that these groups enabled people to receive and provide a lot of emotional relief, that it results in greater health self-efficacy, and it gives people, particularly people with chronic conditions, a greater sense of control over their health and what they're able to do with it and how they might manage it over the long term. The cons, as you might be able to predict, is that there's a lot of potential for misinformation. There are actually also a fair few posts where people are pharmaceutical companies are trying to plug their wares, sell their wares. And there's also the risk of inappropriate online behaviour. I suppose what was interesting for us, and it sort of led to a study that Grania and I are on with colleagues at Wolverhampton, is the finding that there are all these benefits, but if you're not active, so if you're a lurker who signs up to the group but doesn't post anything, you don't get as much out of it. And we weren't really convinced that that's it for that story. So, let's take a non-health example. Hands up if you have ever looked on TripAdvisor or Yelp or a similar such site to just read a review about somewhere where you're going. Straight up, don't be shy. Activity is good for your health. Okay, so hands up, again, if you have ever contributed a review. Okay, so if you look around the room, there are far few people who've contributed a review. And I suspect, so this is thinking in your heads, don't need to put your hand up for this, I suspect that some of you, like me, who read but don't post, don't feel like you're missing out. Like, I don't feel like I'm getting less out of it, because what I actually want is somebody else's information. And so maybe it's not this divide between active and non-active users needs to be further explored. So what the research, so this is an example of the importance of motivations. So Chung et al. Wanted to see if there was a relationship between people's motivations for using online support groups, the particular functions that they used, and then what their perceived social support was. So is there that relationship? And what he found was that people who were interested in looking for information tended to use the discussion boards. People who wanted to go online just to switch off and relax would go on the support groups and look at the blogs. People who wanted to go online to build and maintain relationships with other people in similar situations would use the photo and video sharing options. And so we've got already a link, again, between motivation and the types of functions that you use. What Chung also found was that people who used the discussion boards specifically would report greater perceived information support. And people who used the discussion boards or the blogs or friended others would... Or the aliens have landed. I should have warned you, you need extra time for me for the asides that don't contribute. And so people who use the discussion boards, the blogs and friended others reported that they received more emotional support. So this is a study that's shown that motivation links to what you do online and the functions that you use, and the specific functions then lead to particular outcomes. And again, another shameless plug, what we're looking at is the motivations for people who are active and non-active users for going onto online support groups, whether they're an active or non-active user, what functions they use, if any, and then what social support outcomes they experience. So we've had a chat, sort of one-way chat, about the impact of technology on well-being, and now we're going to move into how we could use these tools to improve what we do for our patients and for ourselves. So this is Australia. The bits with a bit more colour is where most people live. And as you can see, there's a lot of space where a lot of people don't live, and even in the more dense areas, we're fairly spread out. And because there aren't as many people in our regional and rural areas, there aren't as many services. So for us, geographical distance and access to services is a really big thing. People in regional, rural and remote areas don't have access to as many services, and they experience poorer health outcomes. So being able to bridge this geographical gap, potentially through technology, would enable better outcomes for more people. And I suspect that in addition to geography, there are other barriers, to access. For instance, if you are working your 9 to 5, which in reality is probably an 8 till 6, you don't have time to meet somebody in their office hours. But technology enables us to connect in ways that transcend space and time. And that's sort of how I became interested in cyberpsychology. So, what are some of these tools that we have? So this is a very poor screenshot now that I look at it, of an acceptance and commitment therapy based tool. So it's a series of 9 modules. They're framed as a game and it's called Fearless. It's aimed to reduce anxiety in young people and has been shown to be effective, particularly through the gamification of the different modules. We have another example for people who stutter. So the Australian Stuttering Research Centre have created this online module for people who aren't able to attend their clinic, which is a little bit further out in Western Sydney. So these people who stutter tend to experience a lot of social anxiety, and so in addition to seeing a speech pathologist for help with your speech, they often will see a psychologist about their social anxiety as well. And so again, this is a way of enabling people to access therapy that is at their own pace and in their own time. So these are all self-help modules that don't have an active therapist or psychologist sitting sort of by your side and guiding you through it. This one that we've designed at the university was done with years of user testing and user feedback, and that's why even though it's self-guided, you've got images of our 2 psychologists up there, because the people who were working through it liked the idea of having somebody with them. So even though they knew it was self-paced, to have avatars there with pop-up speech bubbles saying, "That's great, now that you've done this, have you thought about this?" really helped them through the process and helped with adherence, because these programs tend to have very low adherence. Our Mood Gym was created, as in the country, not Sydney Uni, in Canberra through the Australian National University, and this is one of the more widely tested of the online support programs. And Mood Gym is self-help based on cognitive behaviour therapy and has been shown to be effective for young adults and even people who are a little bit older. So this is all well and good, and there's evidence that this is better than a control, but how does it compare to face-to-face? So Satie in 2010 conducted a study where she compared Mood Gym with a control with Facebook, and then with face-to-face therapy, and then face-to-face therapy and online therapy in conjunction with each other. And she looked at symptoms of anxiety, depression and distress. And what you can see is that for a number of these symptoms, using face-to-face therapy in conjunction with online therapy was more effective, or at least as effective as face-to-face therapy. And so what they were able to show is that there's something about setting these online modules as sort of homework between the sessions that enables people to reinforce the ideas and the skills that they practice in their face-to-face sessions. So it seems then that there's potential, maybe, for us to do something with technology. And so we started looking about how we could do this beyond psychotherapy. A common criticism at home is that, oh, that's great, it's a talking therapy, of course you can do that on the internet. What about physiotherapy? So I'm currently working with physiotherapists, and what we're interested in is whether you can accurately assess somebody with facial nerve paralysis online the way you would face-to-face. And this is a problem in Australia because our services are quite far apart, and we have one one multidisciplinary team of surgeons and physiotherapists in Sydney. And so if you're someone interstate and you were injured in a brawl fight or you have Bell's palsy, you would have to fly interstate to get access to this team. So being able to provide the service and being able to know that we're doing it well remotely means that, you know, even if it's just one session that the person's missing out on, that's several $100s in flights, several $100s in accommodation for somebody who knows that for a very long time in their life they're going to have to keep coming back to see health professionals. Makes a difference. And so this is a study that's currently ongoing. We've tested the physicians in their assessments face-to-face, and we're now currently doing the video assessments, and we don't know the answer. So I'm sort of not really here to sell that it will work. We don't know the answer. When we spoke to the doctors, they were saying that they like being able to touch their patients, but they're not convinced that that touching is necessary, and whether that's something that's important to the assessment process or important to the way those doctors practice, we're not sure. So watch this space. So it seems that there's something to be said for being able to use technology to do what it's good at and then letting humans do what we're good at. So I'm currently working with the Children's Hospital Network in Sydney. So we have two large children's hospitals, and what they've done is launched an app. So we don't have open notes at home, so that's something that's very new and quite controversial. So this patient portal, this My Health Memory app, allows patients to book appointments on their phone. They'll receive pop-up reminders. In time, they will be able to see their medical records. They're able to send a quick message to their healthcare team. So we're piloting it in families of children with a chronic disease, so cystic fibrosis, chronic cancer, chronic asthma, and heart disease. And what these families have access to is somebody that they can send an SMS to, and there's their health professional team that can answer it. So it could be something like, so-and-so is still drowsy, should I wake her up to give her her medication? Or this has happened, should I be going to emergency, or is it okay to wait till tomorrow? And our families get overwhelmed with information when they come to the clinic, or even on a phone call, that, you know, they're reassured at the time, and then they think, hang on, what did they say about this medication? What did they say about eating before this, that, or the other? And so this app allows people to have these conversations in their own time without having to wait 6 months for an appointment. And it's all there in writing so that they can go back and review it again. Patients are able to enter in information that works well about them and about their priorities. So when I was at the facial nerve clinic, one of the plastic surgeons was really fixated with the fact that the patient's eyebrow was in the wrong place. It was too elevated. And he was like, oh, but I can fix this, and we could do this and do this. And the patient just kept repeatedly saying, can you fix my smile? I know my eyebrow's not where it should be, but what's important to me is my smile. Can you fix that first? And so by enabling a section where the patients can enter in what they want to prioritise within limits, it allows our health professionals to think about what their recommendations might be in a way that's meaningful in the context of the patient and their family. There are interactive education resources that can be prescribed as activities in between sessions as well. And so the idea behind this app or this patient portal is that it will allow the technology to do what it's good at, because there are some things that it does better than us, but it also means that those face-to-face sessions become a lot more meaningful, because you're not having to worry about describing a particular exercise and writing down these routines. You can prescribe all of that through the app, and then the patients and their families have time to ask the questions that matter to them in the face-to-face sessions. And so where are we? So we've just had a big-ish talk about where we are in terms of the evidence. So technology does impact us, but there's something around motivation that might moderate or mediate the impact of the use of digital technologies on our well-being. And where we want to be is in a place where we're asking questions and answering them in methodologically sound ways to enable the technology to do what it does well so that we can do what we do well. So thank you. At the front and then, yes.
So yesterday we talked about the dark tetrad and some of the, I guess what I got from that was there's some psycho-emotional characteristics that we see in bad actors, and that maybe somehow that's urging them on to their bad online behavior. So I'm wondering if you, thinking about that, if you see any opportunities for using these kinds of tools that you're talking about to somehow meet their needs in ways so that they wouldn't have to go online and do bad things, like, sending them SMS inquiries, how are you feeling the urge to do something bad, and, somehow using that as an opportunity for intervention. And if so, do you have any ideas, other than the very silly example that I just gave, where you might be able to do that, and how you would reach out and find those kinds of individuals and interact with them?
Okay. Thank you for your question. So I suppose firstly I want to sort of address the assumption around, I don't know if typecast is the right word, but essentially profiling people based on personality characteristics. I personally am not at the moment convinced about the research on that. We can't even tell. We don't have consistent evidence to be able to say an extroverted person will behave in these ways online. In terms of using digital technologies as interventions, yes. So we have an institute called the Black Dog Institute at home, and they focus specifically on depression and suicide prevention. And what they've been able to do is identify linguistic markers in tweets to identify people who might be at risk of suicide, and then to intervene in those instances. Instagram here, so we don't have the function at home, but Instagram in the United States allows people to, if you see the post of somebody that you're following and it doesn't seem like they're themselves, that something might be a little bit wrong, you can let Instagram know, and Instagram will then send that person a notification saying, somebody who's followed you is worried about you, is everything okay? If things aren't okay, here are 3 support options that you can access. They've also started monitoring particular hashtags, so some of the ones around promoting eating disorders, and banning those hashtags and keeping an eye on the other ones that pop up. So yes, there is a potential for...
So if we could somehow come up with some of these markers, then we might be able to do something.
Yes.
Okay.
Yeah.
Thank you.
You're welcome, sorry.
So I was just going to ask, in terms of implementation, it seems like one interesting concern is in the rural areas, are people actually, do they have access to the necessary technology? And also, does the technology have the necessary capabilities to be able to actually engage in these particular...
Great question. So for the people at home who might not have heard it, the question was around, in rural and remote areas, do people have access to technology, and is the technology adequate for their needs to engage with health services? What we do is, so depending on the service, either we will set up centres in rural remote areas where they've got access to computers, the internet and so on, or in some of our organisations. So we have a teleschool for the Royal Institute of Deaf and Blind Children, and they do really cool things like teach blind children how to play guitar over video conferencing. What they do is they will send out a pack to the families, and they will send out whatever equipment they have. They'll send the equivalent out to the families so that when somebody is showing the little boy or the little girl how to do something, he or she has the same equipment that the person who's demonstrating it to them has. Yes?
One of the presentations was about the avatars that you presented. I was wondering, and I saw the pictures were of one white man and one white woman. Have you considered bringing in avatars that would perhaps reflect some of the people who are living in the rural areas that may not look white?
Yes, so the question was around the avatars and whether they might be more representative of the diversity. And yes, we have. So we're also, Australia is quite multicultural. As you can see, I don't look like what you would think an Australian person would look like. For people playing at home, and if you can't see me, I am Vietnamese by background, so I don't have blonde hair, blue eyes, and I cannot surf. And so for us, reaching culturally and linguistically diverse communities is really important. So we have translators, we are looking at different avatars, and so with the My Health Memory app as well, we're also looking at different languages. Okay, over to you, Scott. Thank you.